Okay, now we get back to the community. So how does the role of community play in helping raise awareness, support NCD's management for everyone? Thank you.
Okay, thank you, Madam Coordinator, for the question. And actually, before I answer the question directly, may I share like for 1 minute a little about the NCD's burden and what do we mean when we speak about non-communicable diseases management. Actually, according to the data that was reported last year by the World Health Organization, it showed that non-communicable diseases caused 74% of death globally, meaning that in every 100 people that are dying in the world, 74%, 74 of them are dying due to non-communicable diseases, and only 26 that are dying due to other causes. And among those who are dying due to non-communicable diseases, 77% of them are coming from low and middle countries, the countries that most of us in here are currently living in. So we see how serious non-communicable disease is in our country. And when we speak about non-communicable diseases management, it includes a variety of activities, from detection, screening, treatment, as well as provision of palliative care to those patients that are really in need of it. As you know that there are certain stages of diseases that we cannot treat. However, we can just support the patient, ensuring that they are free from pain and their life is good for the remaining days, weeks, months, or years that they have. Now coming back to the question that has been asked about what roles does the community play in ensuring that all is supporting NCD's awareness as well as supporting NCD's management. Starting with the level of awareness, how does the community support it? We know that the key role or the key aspect in raising the level of awareness is through provision of the right information about that specific thing. Hence, for this issue, for the issue of raising awareness about NCDs in our community, these community leaders, local organizations have to collaborate with the medical personnel that are available in the area. Whether they are the physicians, the nurses, nurses, and so on, they have to collaborate with them, ensuring that these medical personnel provide the right information about the NCDs to the community members. From the risk signs, the symptoms, the rates of diagnosis, and the treatments available. But also the other video easier way that has been used by the community to raise awareness about NCDs has been shared by the previous speaker. It is about the issue of designing recreational programs, such as community marathon, community sports, and competition. As we know that in these programs, we bring together a lot of members with different understandings about non-communicable diseases, and we can use a part of time in these programs discussing about NCDs. While discussing, we'll be raising the level of awareness as well as trying to identify the main challenge about NCDs facing that community. It is known that not all communities have the same kind of challenge about NCDs. Some are suffering from lack of information. Some are aware about NCDs, but they don't know about screening. And some are aware, they know about screening, but their knowledge about treatment is really low. So it is through this discussion that we raise awareness as well as identifying the main challenge for a specific community. And coming to the roles played by the community on supporting NCD's management. The first one that I had has also been shared by Dr. Eric Luther on facilitating for lifestyle change, as how it has been discussed. I don't have to repeat about it again. But the other thing is the community has a role in discouraging the negative social norms as well as the negative cultural practices that are being done in our communities that have negative effects in our home. I know that most of us in here are Tanzanians and some who are not from this country, but we know that there are certain tribes that support physical abuse. specifically to women and young ladies. And we know that this physical abuse lead to physical disabilities as well as mental health issues. Hence, as a community, as community members, as community leaders, as local organizations, we have to discourage these cultural practices that have a negative effects in our home. And also the other thing, as how the question posed that, the ways that the community support NCD's management, also not only to those who are sick, but to the general population. So the other thing that can be done is by encouraging sustainable agricultural practices in both crop cultivation as well as in animal production. The reason is being that we are the ones that are going to consume these products. If they are not prepared sustainably, we are putting ourselves into more risk of exposure to carcinogenics and so on, hence putting ourselves into increased risk of NCDs. As we saw that one of the main risk of NCD is also a poor lifestyle, a poor eating habits. It means that from the things that we are eating to the ways that we are eating it. Hence, as a community, as community members, as those who are community leaders, they have to facilitate sustainable practices, sustainable agricultural practices. And the next point that I had has also been shared by Dr. Eric on putting more emphasis on regular checkups and screening. As some of these non-communicable diseases are really silent. If you wait for signs and symptoms to get checked up, you will be very late. And as we know that the late the diagnosis, the harder the management. And the earlier the diagnosis, the easier the management. And despite lack of enough published statistics about the role of the community in supporting NCD's awareness and management, we have to know that the community is a really important figure in fighting non-communicable diseases, and it is one of the pillars in ensuring that we achieve the World Health Organization goals by 2030, the Sustainable Development Goal number 3, that's good health and well-being. And so thank you for this chance and for giving me a chance to share a little bit about the non-communicable diseases and the importance of community in non-communicable diseases awareness and NCD's management. Thank you.